Things are going so well. I'm so excited. I've stayed off of my updates just to try to settle in and see exactly what was happening. And so sometimes things will happen and then they won't happen again. And so I don't want to get my hopes up too much. But about a week ago, Dawn was bringing in the chair from the deck. So we stood me up at the kitchen counter and I was holding onto the kitchen counter and locking my legs. And then I decided, I'm just going to try, because like I said, the connections in my legs have been relatively active lately, and my system is tending to feel more open, and my muscles are responding a lot better than they used to. So I put all of my weight on my right leg, and I thought, I'm just going to try to lift my knee, because that's been my issue. I haven't been able to lift my knees. So somehow that connection has gotten lost with all of this. I bent my knee and I picked up my heel, and normally my toe would stay stuck like cement right to the ground. And with all of my might, I pulled my leg and all of my muscles and all my heart, and I lifted my toe off the floor by about 4 inches, which is huge. So we're absolutely celebrating that. And it's been a little bit now, and I'm still able to do it. I'm doing my exercises every night. These improvements do not come without consistent physical therapy, whether you're doing it at an medical office of some kind or you're doing it on your own. Find out what those exercises are and just get on it right away. And I know for most of us with chronic pain, the one thing you're really scared of is that, oh my God, I'm going to start doing these exercises and I'm going to be in too much pain and then I'm going to flare. After stem cell transplant, you really don't have to worry about it that much. It's not the same as it was before the transplant. So you have to have some faith. And the most important thing for you is to be active and be as active as you can without overdoing it. If you overdo it, you know to stop and you let your body rest. The other really exciting thing is normally I was only able to sit before the transplant for maximum 30 minutes. On a really good day, maybe it was 40 minutes. I'm sitting now, for 2 hours at a pop. And then I can lay down for about 10 or 15 minutes in the car or wherever we are, and I can go another 2 to 2.5 hours. So I was able to be out of the house maybe an hour and a half. Now I'm going maybe 4.5, 5 hours at a shot. I started driving myself again. I was out on my own for 2 hours, and it was so exciting. And I'm starting to get my mojo back. Yeah, so this is kind of fun, getting better and all this stuff. So we'll see what happens from here on out. I know there are a few other, my sleep has improved. That's a really weird thing, is my sleep has improved. And I've been able to cut back on sleeping medication with chronic pain. Sleeping is one of the biggest issues that we have. So I've had to use sleep medication now for 5-6 years. And ever since the transplant, I've been waking up a little bit groggy, and I could feel it was from the sleeping medication. So I started cutting back. And I've cut back by 75% just in the last 20 days. So lots of great news. Everybody hang in there if you're going through this, if you're thinking about going through it, if you're not sure you want to do it. I felt the same way. And I think that when you get to the point where there's nothing left to try, you can say yes. And unfortunately, that's how long I waited. So stem cells, yay! And the last thing that I wanted to mention was that my best hours are between 11 o'clock and 2 o'clock. That's pretty much just consistent across the board. And then from 2 o'clock till about 6, I seriously feel like I've been hit by a truck. That when you hit those moments or those hours and when you feel like you're moving backwards and how can I be in this much pain? I felt so great all morning. I just did a couple of things, and the truth is that the stem cell transplant is all about not only eradicating inflammation. A lot of people think that stem cell transplants are about just eliminating inflammation so that you're out of pain. This type of transplant is not about just that. It is literally eating away scar tissue and rebuilding structures. And that takes a lot of energy from your body. A lot of the pain that you're going to be experiencing is not like the old pain. It's going to feel different. The reason why it feels different is because it's a constructive pain. So don't be afraid of it. And when your body's exhausted like that and you feel like you've hit a wall, like Game of Thrones wall, like White Walkers are gonna come and get you, just take a deep breath and know that's because your body's working. It's under construction and it's all okay. Just take care of yourself and don't be so hard on yourself and have patience. And I think that's been the hardest part for me, is having patience with myself, because I want to be better now. So right now I'm going on a date with my husband. We're gonna go see a movie. We're seeing Baby Driver, I think. And then we might get a bite to eat. And we might go for a walk and roll, you know? I think we're gonna take our time and maybe even look at the sunset. Yeah, I think we'll do that. Maybe we'll do a few things. You know why? Because we can. Bye. I'll check in soon.